My name is Stephen Barry. I was in the U.S. Army, 64, 65. I have a breathing problem, and I was in ICU and stuff like that. And gave me a CAT scan, getting close to leaving, With the CAT scan, I knew there was something going on. Two doctors walked in to see me with some other nurses, and you know why you're here? It's I got cancer.
My name is Jennifer Smith. I'm a nurse practitioner that's been with the VA for about 14 years. Currently, I am the clinical management director of our cancer program. I focus more on after active treatment and what we can use to take to not only do the surveillance and the check boxes that we need to do to follow guidelines to make sure that we're doing appropriate labs, exams, imaging, but also really what is important to the patient and a new way to look at a new beginning and what can we do to really get to the kind of life that they want to live in the post-cancer realm.
I almost committed suicide, but I talked myself out of it. The chaplain came in to see me and we talked, and she says, how are you handling this? Well, how are you handling this? I says, PMA. What's PMA? It's positive mental attitude. You can actually talk yourself into believing. My attitude is, I can beat this. They had the radiation treatment for me, and then they've been monitoring me pretty closely. Jennifer, she's been a sweetheart. She cared. That extra time she spent with me, that helped me a lot because I get stressed out. I don't go to bars that much anymore, and the only friends I have are at the bar are my other friend there.
Mr. Barry came to me a few years ago and really has opened up just in terms of reflecting back on things that he wanted to change, things that he knew he needed to face in order to kind of continue to move forward, identifying those things that were important to him. The best way for me to be able to kind of help somebody through it is to ask that question of what is either their biggest worry, their biggest concern, or their biggest goal for themselves. Listening and understanding what is important to patients helps you to better be able to help them through and also buy into their own health care. Because I feel if patients feel that you're invested not just in their cancer or their illness, but you're invested in how their kids are doing, investing in how they're doing, they're much more willing and wanting to buy into that philosophy, which is really what whole health is. Whether that's pain relief, whether that's exercise, whether that's just a better state of mental well-being.
They just sit there and they listen. They didn't tell me a thing. I was able to talk out loud, knowing that they cared. That somebody caring for it, it gives you a will to live.